are here with another episode of Under Contract. As you all know, the contracts that we make with ourselves are so important, whether it's in your health, business, professional, personal, or all of the above. It's very important to not only make these contracts with yourself, but to follow through with them. And if you've been following me for a while, you know I've been on this health journey with just kind of going down the rabbit hole and trying to figure out the best way to optimize my health, not to anti-age or not to anti-do anything, but to optimize what I have. And having gone through breast implant illness, I've done a deep dive on everything that was a toxin in my body, hormone disruptors, and anything related to my everyday health, including whole body health. My question is this, because today's guests are two leading biologic dentists who each specialize in covering oral health, which connects to everyday health, whether it's inflammation or hormonal balance. And if I asked you, the audience, what if the dental work in your mouth and even the products you use every day could be quietly impacting your whole body health? That's the question we're going to unpack. And having Dr. Michelle Jorgensen and Dr. Nicole Vane on today, they are leading the charge, in my opinion, with biological approach to dentistry and why it matters more than most people realize. So welcome, doctors.
Thank you.
Thank you for
Thank
having me.
you. I'm very, very excited about this. As you know, we were talking a little bit off camera, and Dr. Vane, you and I have spoke briefly about this. In plastic surgery, many patients aren't warned, especially when it comes to breast implants. They aren't warned about breast implant illness and the symptoms that appear. Do you feel, and I'll start with you, Dr. Michelle, do you feel there are similar silent risks when it comes to standard dental materials?
Absolutely, because they're just standard. That's the thing. Nearly
Right.
every dentist is doing the exact same procedure, and we're just doing what we were told and taught.
Mm,
It's the standard. In fact, the phrase is used standard of care. It's the standard of care. It's the same materials, it's the same techniques that we were taught in school when I was taught, 30 years ago in school. And the problem is there are a lot of things that research has actually uncovered that are problematic about those procedures and materials both
mm,
Mhm.
that no one's talking about. And the problem I find is that there's often a deep resistance, not only in just the public at large, but even more so in the profession
right.
to change. And it's difficult. I remember when I first learned about how many root canals actually fail. And I had to swallow my pride and realize that I had
Mhm.
done hundreds of
Yeah.
them myself.
Yeah.
And I remember this one patient in particular, she came and we did it's called a cone beam CT scan. It's just a state-of-the-art diagnostic tool that we use to see things. We did a cone beam CT scan on her, and she had 3 infected root canals, badly infected root canals along her lower jaw. And I looked at her chart and I saw that I was the one that had done all 3 of those root canals. And that's the
Yeah.
day when you have to get real honest with yourself and say, am I here to cover up what's going on to save my own pride and everything else? Or am I here to make sure that my patient receives health and the best care possible? And so I had to sit down knee to knee with her and say, well, we got you 10 more years out of those teeth, but it's time that they come out. There's
There,
infection here, and I did my best, and they still failed, and that's what we see every day is even though root canals and dentists are doing their best, there's just parts of the procedure that there's nothing we can do about, and they're going to reinfect oftentimes. So
Mhm.
that's, I think, why we get so much resistance. It's hard to say we were wrong.
Yeah.
yeah. So that's such, you are such an anomaly in this business. Both of you are, because the fact that you put the patient's true well-being at the very top of this, right? Because you acknowledge it and you're really looking to help that patient. I can tell you right now, when I went through my journey, I went through a plethora of doctors who told me it was all in my head and they gaslit me in the whole 9 yards. And I then said, finally, one day when I took my health back, and I said, you know what, with all due respect, doctor, you're still trying to figure out this thing called medicine because you're practicing medicine. You haven't figured it out yet. With all due respect. Good points. So, Dr. Vane, what is the connection between what's placed in your mouth and long-term systemic health, including inflammation? And what products would you say lead towards low-grade infections?
Oh gosh, that's a very complicated question.
Yes.
A lot of what we're doing with our dental work is we can have foreign body reactions or sensitivities to the plastics and the materials we use. It could be sensitivities to the metals or where your body is rejecting essentially your own tooth with something like a root canal, where it becomes like a foreign body to your body's inflammatory response because of the materials that we're putting inside of the tooth.
Yeah.
So you can have, I'm trying to find the best way to answer your question because it's so layered. In terms of products, what's in them really matters,
Mm.
in terms of how they're formulated. If there's, again, any plastics or things that we're not really warned can have a significant impact, especially as they compound within our bodies through being exposed through so many different sources throughout the day. Like Dr. Michelle, that's why you created a clean line of toothpaste products, is because a lot of patients are sensitive to the ingredients in toothpaste,
Yeah.
and we're
Yeah.
taking that in all day. So it can what we do is, on patients that can be sensitive to metals, it could be sensitive, again, to plastic, it could be to the type of filling materials we use that are deep inside the tooth. It can really cause a reaction throughout the whole body.
Yeah.
I don't know if
I've been on the receiving end of that, before I knew how allergic and sensitive I was to nickel and iodine and all these other things. I'm going and getting standard dentistry work done, wondering why I come out of there feeling worse and having an outbreak on my face or in my mouth or what have you. So I think the standard of care now has shifted with biologic dentistry. So I'm going to ask this question to both of you, and I kind of off camera learned a little bit about Dr. Michelle's why. Why biologic dentistry? We all have a pain to purpose. And if you could share with me concisely what your pain to purpose was, because biologic dentistry, not everyone understands what this is, right? I think with the advent of becoming more optimizing with our health and the things that we eat and the things that we choose to surround ourselves with, homes that are healthy, EMF detectors, healthy water, all the things that we're doing as a consumer, biologic dentistry is a natural fit. It's a natural progression for someone who's going down this path. So each one of you has that pain to purpose. If you could concisely share that with me, and Dr. Michelle, we'll start with you, because obviously it led you to this big, company with all these products and whatnot. What was your pain to purpose?
So I'm a general dentist and I was practicing and thought I would be practicing forever. My father's actually in his late 70s and he's still practicing dentistry.
Mm.
But that's not what happened for me. At about 10 years in, I started getting really sick. It was gut health issues, memory issues. I couldn't complete sentences, and my hands just had such painful numbness all the way down my arms. I couldn't sleep at night. I couldn't blow dry my hair. And it got to the point where I couldn't hold my instruments. So no doctor had an answer. I'd done every test, I'd taken every x-ray, I'd done everything that they recommended, and it had improved a little, but not a lot. So I actually put my practice for sale. And we had 4 young kids. This was the entire income for our family. We didn't know what we were going to do. And at that point, I finally talked with another practitioner who said, have you ever thought about mercury poisoning as a
Mm.
possibility? And the only thing I'd been taught in school is that if I told anyone that their fillings, because I knew that silver fillings are 50%
yeah.
mercury. Every dentist is taught that in school, but they tell us that it's completely inert and safe once it's in that filling. No worries, no problem. And if you tell someone it can affect their health, you will lose your license.
Mm.
So that's what I was told in school. So I said, no, no, no. I don't have any fillings and, I know that they're perfectly safe. And this other dentist said, well, isn't it worth getting tested? Said, it's not the fillings you have, it's the fillings you've been drilling out for the last decade with no protection. And then that was the first time I had ever heard those words. So I got tested and that's what it was, mercury toxicity off the charts. So now all of a sudden I started questioning everything because I said, this thing that's such a standard of care inside of our industry nearly cost me my life and my career. So what else is there? And honestly, I didn't have to do a lot of research because patients started asking me questions. As I started positioning myself this way and doing things in a different way, I thought everybody would run away screaming like, "Who is this crazy woman?"
Oh, yeah.
But they didn't. They actually it was the
She's
opposite.
woo woo. She's too woo woo for us. What's going on here?
And some did leave, some did leave,
Yeah.
but
Yeah.
mostly they said, "Well, isn't this better for me too?"
Yeah.
"Yeah, it is." And
Mhm.
then they started asking me, just really provocative questions like, "Well, what do you really know about root canals? I've heard some things, and what about fluoride? What's the real truth there? What do you really know beyond what they just taught you in dental school?" And I didn't have answers for them, and I thought,
Mm.
"Well, if this one thing could have, done this much harm and I didn't know anything about it, it's probably worth investigating these others as well." And so I started investigating, and that's where it took me is to a completely different place where we recognize not only the opportunity that we have to help people be well starting in their mouth, but also the responsibility that dentists have. We as dentists see patients more than any other healthcare provider. Maybe not more than somebody who does your hair. Like the beautician might be more, but we're kind of maybe just second to them. Nobody goes to their doctor every 6 months like for a
Right.
tune-up, like you do to the dentist. So
Yeah.
we have
And
a
we should though.
responsibility. We
We
should.
should though.
I
Yeah, we
totally
should.
know.
So I love that this is my favorite question when I'm interviewing guests because it not that you need credibility, but it brings so much power to what you're doing, right? And I feel like when we experience a health crisis, and we all do at some point, that can either be our pain to purpose or we just kind of let it be more of the same. So I appreciate the fact that you took this and said, okay, I don't want to feel this way anymore. How can I not only heal, but how can I pass this on to other people and educate them and make them, feel better during their journey when it comes to dentistry? So Dr. Vane, what about you? What was your pain to purpose?
Actually, like almost an identical story. And I think it caused me to seek so many different opinions that I
Mm.
found I had to get myself really educated first to start asking better questions and to find the right provider. So that was part of the initial part of the journey. Then, when I was diagnosed with mercury toxicity, the doctor who ended up doing my lab said, "How did you know? You don't even have any silver fillings." And I said, "I just had a feeling the symptoms I was having were correlated with the toxicity of being in the dental environment." We're just around so many different types of acrylics and metal. We're just breathing it in all the time, especially when we're in school. So my exposure was actually in the field also. We're drilling out all of these fillings. I found out genetically that I'm very hypersensitized individual. Many of us have the same genetics, who suffer from the same symptoms Dr. Michelle and I had. And so I ended up doing a detox, and then what ended up happening was my hormones regulated, and so all of a sudden everything was functioning better. My labs got perfect. It wasn't an easy detox process, but seeing how my Hashimoto's disease went away and my gut issues that I'd had forever turns out were related to the heavy metal. And also, we identified a lot of food sensitivities. So, understanding the difference between allergy and reaction within our body and how our bodies process things was really powerful for me, and learning how I felt different after I went through the detox. And then also, it helped me really empathize and become a lot more passionate about how to get some of these materials out of our patients' bodies.
Right.
Especially the more you start to remove root canals, like Dr. Michelle had mentioned, and I love looking at the extracted tooth, and you see the gangrene and like the little metal files we use sticking out of the ends of it. And then I look at the x-ray, and sometimes you can see these things and sometimes you can't. And a lot of times too, when we're cleaning out some of these infections, they're so much bigger than they look on an x-ray, and the mouth might even look completely normal when you're just looking with our traditional dental eye.
Yeah.
And so all of that has been really enlightening on seeing how patients get so much better right away, or how they feel really differently, either lighter or their brain fog goes away or some other random symptoms they were having. So a lot of that has helped me become more passionate about investigating what their root cause may be,
Right.
because a lot of times it's not obvious.
So when you decided to get into biologic dentistry, and this can be for either of you or both of you, what was it besides your own health journey? And for the layperson watching, what exactly is a biological dentist? I mean, I know, but what would you say in layman terms?
So I'm going to answer this one because I had to struggle with myself a little bit. First, the only term that I knew to call myself was a holistic dentist. But
Yeah.
that term holistic comes with some baggage.
Mm, definitely does.
People imagine that you're wearing tie dye and you're doing the peace signs and you've
Yeah.
got beads hanging in your
Woo
doorway,
woo.
smoking incense, and
Yeah.
all these kinds of things. And especially inside of the profession, they say, "Oh, that's not science backed. That's just all about stories." And that's really how it's positioned. And so in fact, if anyone comes to my practice, they'll say, "Well, you are like the most technologically advanced dental practice I've ever been to in my whole life." I'm like, "Yes, because we actually have to defend everything we do."
That's right.
Every other dentist, is anyone asking them questions? Is
Right.
anyone putting their feet to the fire saying, "Well, show me research to prove what you're doing"? They're just going with the flow over there, so we actually have to prove it. So
Yeah.
I stopped calling myself a holistic dentist. Biologic is a step up from that, but it actually people don't know what it means.
Right.
So
Mhm.
I like to call myself a health-based dentist.
Mm.
Basically, it's How does the health of the mouth affect the health of you? And how does the health of you affect the health of the mouth? It's all the same you. So why shouldn't it be connected head to toe? So that's why I like to call it health based. Basically, I can tell you if you have diabetes. I can tell you if you have heart disease. I can tell you
Mhm.
if you have gum issues or gut issues
Yeah.
just by looking in your mouth.
Yeah.
So that's what health based dentistry means
I
is
love
connect
that.
you head to toe.
Yeah, and that's so true because you treat the whole person, right? And in breast implant illness, it's the same approach, right? We've got these implants in your body that are, covered in silicone and all the heavy metals and all the toxins, but the saline, as we were told, you're fine because it's saline. Your body's comprised of saline anyway. You're going to be okay. And back then there was no black box warning, right? So when you put these and this goes back to what's in your mouth. When you put these foreign objects in your mouth, whether it's a mercury filling or anything else, it's going to cause issues. Let's go back to the mercury aspect of it, Dr. Michelle. So beyond mercury, what risks come from plastics, BPA, and additives in fillings, and even the sealants?
So Dr. Vane, I'm gonna let you it's your turn. You're up next. If you
Go.
want what do you think are sealants?
Well, in terms of BPA, for instance, a lot of
Yeah.
them are hormone disruptors. There's a lot of materials that people are sensitive to in the resin cascade process that we use for bonding. And essentially, like once it's in your tooth, you're swallowing it all day long. It's exposed to an acidic environment. Things can become even more reactive when they're in contact with saliva. I'm even worried about the compounding effect of people who get the acrylic nails and then the nail polish and then
TPO.
they get all these different hair dyes and then using eyelash glue. All these things stack, and it might just be the one filling that we do that is the straw that broke the camel's back, and then people become hyper reactive. So it's not just one material that we can always pinpoint. It's how they compound with each other sometimes
Right.
can make the biggest impact with people, especially once they're ill. So like
Right.
with breast implant illness, it's usually not obviously pain in your breast that you notice first, right? It's a reaction
Yeah.
maybe on your skin or somewhere else where it shows up that's downstream of the area that starts causing issues with, again, it's not necessarily the saline, it's how the breast implant's encapsulated. It
Right.
can be the same with some of our cements that we use, or
Yeah.
the titanium in the implant can react with another implant throughout your body. So I think that it's more the compounding effect than just the one ingredient.
Yeah.
Fluoride, for instance, is not harmful if you just paint it on the outside of enamel in a test tube. But then it's when you're swallowing it in the water sources and we're applying it on the teeth, and then we have it in every filling material, and then we have it in every toothpaste. It's the compounding effect throughout your body that can have the most detrimental effects.
And it's like that with anything else, right? Like you just mentioned 5 different things that women typically do, right? Between the false eyelashes and all these other things. I mean, how are you able to rule out by a process of elimination what's causing you issues when you've got 5 different things that are triggering your immune response? And what I learned through my journey is, Tammy, you're not allergic to that. You're having an immune response to it. So where does the immune response and the immune modulation take place? In your gut. Right. So if you've got all these issues going on in your mouth, all these issues going on in your body, or you're reacting to the glue on your
Yeah.
eyelashes, how are we able to know as practitioners? How are you able to know? But when you do your testing, when you do your assessments, you can tell, just like Dr. Michelle said, whether a person has diabetes or not just by looking at their mouth. Right. So it's a compounding effect, which I love that. So, Dr. Michelle, so in your opinion, why is moving from metal to zirconia or ceramic implants so important from a materials and biocompatibility standpoint?
So a lot goes exactly on what Dr. Vane was just talking about. I'll always remember 2 patients that changed my mind for this. So one of them we placed a titanium implant on. It was right when I was about to change. And
I have one in my mouth right now as we speak,
actually so do I. Right
and
here.
Dr. Vane's going to remove it.
Yeah.
I'm going to be a guinea pig for her in about 3 weeks, and I can't wait to get all this stuff taken care of.
Nice, very good. So I
Yes.
placed the titanium implant on this woman and she had excruciating pain.
Mm.
And it was right at a place that's near a nerve. And so I thought, oh no, we just got a little too close to the nerve, you know? So I backed the implant out, pain went away. We decided we were going to put this back in again in about 3 months. Put it back in 3 months. Pain, excruciating. Called me all weekend long. You've got to get this thing out of here. I can't stand it anymore. Took it out. She was so gun shy to put anything in, but I said, I've just learned these new ceramic implants. Let's just give them a try. She finally consented. Put the ceramic implant in. Not a second trouble ever.
Oh.
So that was just an overload issue. She had just had too much. She'd had some back surgery. She had some pins, screws, and some things in her back, and it was just too much. Her body said, time out. I can't do it. Another one, we'd put an implant in, metal implant, titanium implant. She couldn't wear any jewelry after that. Every place that a necklace would touch her skin or earrings would touch her skin would turn bright red and just fiery red. Again, it was just overload. So the problems with titanium are twofold. Number one, they corrode. So the mouth is wet, dark, damp, warm, like all of these things, the perfect situation for corrosion. And what corrosion is just little pieces coming off. Now, every single research study that's researched around titanium implants shows that there are titanium particles in the bone and the gum tissue surrounding the implant. Well, that is a foreign body that your body is going to create a reaction to. So you are going to have a hyper reaction to that no matter what. Every single titanium implant in anyone's body, your body is going to identify this as an invader, and it's going to set up what they're called cytokines, these inflammatory signals saying,
Yep.
trouble, something's going on. So that's problem number one, no matter what. Every single titanium implant, yours and mine both too. They will.
Oh, it's no wonder I'm having all these issues. Darn it.
Number two is frequencies in our world, and this one is a very fascinating one. So we're surrounded by, I mean, how is what I'm doing right now, talking on my screen, getting to the person listening to it? Well, it's coming through waves in the air. These are called
Yeah.
frequencies.
Yeah.
And metal will the metal particles will vibrate in frequencies. This is why you can't put a metal pan in a microwave, because there's frequencies of energy that pass through and heat it up. Well, the same thing's happening with titanium dental implants. As
Oh
the
my gosh.
waves increase in our world, as we're just bombarded with Wi-Fi and 5G and everything else, the waves increase. What they've discovered, and this was in the orthopedic world, shoulders, knees, hips, there's way more of those than there
Prosthetics,
are
yeah.
dentists, in
Yeah.
dental implants. It's heating the titanium up about 4 to 5 degrees. And does that matter? Well, what it's slowly doing is cooking the bone around the dental implant. And there is actually an increase in loss of dental implants. And we as dentists in the dental industry blames it on everything else. They blame it on, oh, there's gum disease here and all the cement got down too far and all of these other reasons. And nobody's saying, actually, it's Wi-Fi that's cooking the bone because of the
10,000%.
metal heating it up. So the beauty of ceramic is it's non-conductive, so it doesn't heat. So we don't have to worry about all the waves that we're surrounded by. I mean, we might worry about them for other reasons, but not for dental implant reasons. The second one is it's non-corrosive. So nothing is going to break off and embed in the tissues around. And when we look at them in the mouth, Dr. Vane can corroborate this, the gums just like them.
Oh, yeah.
Like, they just surround them. They're pink and healthy, and it just looks completely different than when you have a metal implant in the mouth. So for me, there's no discussion. There's no question. Ceramic is the way to go, especially because we know in our world we're going to have more frequencies. We're going
Yeah,
to
the
have
EMFs.
more overload. We're going to have more of these issues. We need to do whatever we can to eliminate it in the mouth.
There's so many parallels here with breast implant illness and these implants that you're putting in the mouth, whether it's, titanium or otherwise, that causes the body to respond the way that it does. And I find it very interesting, the parallels that are going. It's making me go back to when I was going through my health and wellness journey with breast implant illness, how my mouth was such a big issue, the issues in my mouth, and I didn't even know it. I thought, oh, I removed the breast implants, I'm good. But then these chronic issues kept happening up here. Right. So, of course, I, by deduction, thought, oh, let's look at my mouth. What's going on? So, Dr. Vane, in your practice, are you seeing more patients rather, connect chronic symptoms like fatigue or inflammation back to their dental work when they come to your chair for the first time? Because I know you get a lot of patients that come through that have had previous work done and they sit in your chair. Are you seeing a lot of connection there with chronic infections or on previous work that's been done?
I am seeing connection based on reading their health history and their symptoms, patients are seeking answers, but I would say a lot of them have no idea that it's actually their mouth causing them the symptoms. So, like, even my own hygienist, she never had tooth pain. Her mom's a dentist, her sister's a dentist, her other family members are dentists. She had a trauma in the second grade. She started to feel really weird. She's having a lot of anxiety, brain fog issues, whatnot. We took a scan. She's got a giant infection around one of her teeth, but it was never tooth pain. She never said, "This hurts if I push on it." And, so I'm seeing a lot of correlations myself where I'm able to deduce saying, wow, this is going on. I'm sure Dr. Michelle, I know you do this too. Go tell me, like, are you having any gut issues? Have you ever heard of leaky gut? Have you heard of this? Do you ever get rashes on your skin? And people will start opening up more. And sometimes you just see their eyes go wide, like, how did you know that? And a lot of times it's because patients who do have these hidden infections, failing root canals, airway issues, or really bad bugs in their mouth do have a really obvious straight line correlation with some of these other diseases like diabetes, Alzheimer's, autoimmune specifically. A lot of issues come from the mouth, and patients are looking for answers. Like, gosh, I've been all over. I'm really
Yeah.
suffering, and I think this has got to be the only last thing that we haven't looked at. And oftentimes there is an answer right there.
And it's such a in my opinion, and after we finish this interview, I'll probably think even more about it. It is such it is the biggest cause in my opinion, because, there's one thing to have your gut microbiome be in balance and check, right? But your oral microbiome has is equally, if not is more important to have in place and in balance. So Dr. Michelle, in your opinion, why do you feel there isn't more transparency from traditional dentistry around material risks?
Well, you're gonna hear my opinion right now.
In your opinion.
My opinion, let's take the example of the mercury fillings that made both Dr. Vane and I ill.
Yes.
Um, in the world we live in, particularly in the United States, if the American Dental Association were to say that all mercury fillings are dangerous to anyone, they actually have the FDA has come out and said they do not recommend it in children under the age of 6 or pregnant women, which I think, well, if not them, then why anyone? That's the
Mm,
first question I always
mm,
ask. But if the American Dental Association, the FDA, were to say that these mercury fillings are toxic, they're harmful to your health, really any of the things that research studies have now said, every single dentist who has placed or removed a silver filling would be under class action lawsuit.
Mhm.
Are there
Professional
black box warnings? Are there black box warnings associated with this or no?
no.
No.
Ah,
No. So every
interesting.
single dentist would be under a class action lawsuit because we live in the United States and live in a very litigious society.
Mhm.
So who
Interesting.
pays the American Dental Association? Do you pay the American Dental Association dues? No. I do. Every other dentist, we pay the dues. So the American Dental Association is there to protect the profession. And they
Mm,
know that if they were to change their stance on this, that the profession would be at legal risk.
yeah.
So their job is to keep us safe. So they can't say these things. That's why we as dentists have to share these things ourselves because it
Mhm.
will not come from inside of the profession. It will come from you and other people just like you who are demanding something different and saying, we are only going to go to someone who's doing this and understanding this.
Yeah.
And that demand will ask enough that the profession will have to set up. They've already started to pay a little attention about fluoride. All of a sudden, this is starting to become a little bit more of a thing, not because the profession has said that the change needs to happen, but because you and all of you
Consumer.
who are
Yeah.
listening
Yeah.
are
Yeah.
saying we want something else.
Yeah.
You know,
So,
I was just gonna add to that. It's also true with vaccine injury. I see a
yeah.
lot of vaccine injured patients that are like, I got the most recent round of big vaccines, and then I started having this issue. My eyebrows fell out. I had chronic fatigue. I couldn't get out of bed. One of my patients who was 28 had a heart attack immediately after getting one of these vaccines. And the medical industry doesn't want to say this is
Right.
correlated. You will find
Right.
doctors who do, but it's are uh, are facing a backlash against your own community who are protective of our profession. So it's hard because you risk being attacked for standing up on what you believe in and what we see and know to be true in our own patients. So we can still choose to not place mercury, but we're not really allowed to publicly go out and tell everyone if you do this, or if you have it unsafely removed, or if you're still placing it, that you're in the wrong and you're actually harming your patients. No dentist wants to be labeled that way.
It's amazing, and again, the parallels in the breast implant illness, where the few surgeons who perform explants, again, they're faced with that same thing, right? Because they cannot legally tell you, "Do not do this,"
Mhm.
right? Do not do, because big pharma is too much money when it
Yeah.
comes to implant surgeries. Breast augmentations is a multi-million-dollar business, right? So they can't legally come out and say, you can't do this," right? I don't know what the legal ramifications are, but what the patient wants, the patient wants. So to follow up with that, Dr. Vane, before any permanent materials are placed,
Mhm.
what's the number one question patients, in your opinion, should ask their dentist
Oh, Dr. Michelle, you
before
might be
any
better.
permanent material is placed? Yeah, before anything's placed, what's the number one question a patient should ask you?
Well, I feel like it's on the patient to really vet the dentist and make sure they're even aware that there's a correlation. So if they're already in a biologic dentist's
Hmm.
office, I would ask the dentist more about their opinion on materials, like how do you choose which material are you going to use for a crown?
Yeah.
Most of us use one of two materials, either lithium disilicate or zirconia. Most of us are metal free, so I would ask if they're a metal free practice. I would
Mm.
ask if they place titanium implants. It'll help you better understand and uncover the doctor's philosophy. How do they feel about root canals if you have them? Those are some of the places I would start.
Right.
Um, are they familiar with biocompatibility testing? Not
Right.
every patient is so sensitive that they need to have a full panel. We can actually do a test to discover almost every dental material we use in an office. It'll tell you if you are reactive to one material versus another. But on the whole, I would just ask if they are metal free or titanium free or what
Yeah.
their philosophy is about those first. What
And
about
I
you,
feel like the
Dr.
layperson, they don't necessarily know the importance of that being present, right? So by the time they come to you, either one of you, they have some knowledge of what you're providing. And they know that this could be the missing component in their puzzle that has yet to be solved. Dr. Michelle, in your practice, what are some of the biggest red flags you look for during a dental assessment that you're doing?
So, like I talked about earlier, that cone beam CT scan is
Mhm.
Mm,
really it's a non-negotiable.
yeah.
And, the first time I remember really deciding I needed to use the scan as a patient that was complaining about an old root canal, and not even complaining, just saying, "It's always a bother, like, I just don't know why, it just never feels right." So we took a regular dental X-ray, the kind that everybody uses, right? The one that goes in your mouth. Everybody's had these before. Took a regular dental X-ray, and I said, "It looks fine." But I had just gotten my new cone beam CT machine. So I said, "Let's go take a scan. Let's just go see." Took the scan, and my jaw just dropped. There was literally a quarter size hole that had been eaten away in her jawbone above the end of this tooth that I couldn't see. So dentists can't see it. It's not that they're ignoring the problems that are there, they can't see the problems that are there. So
Mm.
that's the first thing that we look through. And what I do is I literally go through from the side of your head all the way through your ear, your airway, your sinuses, your teeth, and then all the way out the other side. Jaw joint, we're looking at everything all the way across. So that is a non-negotiable, and then we start to put the puzzle together. We start to look at signs of inflammation, which are gonna show up as autoimmune disease,
Mhm.
often multiple autoimmune diseases, as heart disease, high blood pressure, things like not sleeping well, having a real difficult time going to sleep at night, waking up fatigued even though you felt like you slept a long time.
Yeah.
These are all things that people don't put two and two together and say, I think that's from my teeth. My Hashimoto's disease, I believe it's
Mhm.
my tooth that's the problem. Nobody's saying that. So we as dentists, that's our job, is to put those
Yeah.
puzzle pieces together. So we ask all the questions. Tell us what's going on. How are you
Yeah.
feeling?
Yeah.
What is your body struggling with right now? And then we use those really refined diagnostic tools like this scan. We say, ah, this makes so much sense. You know what? I am just amazed that you're doing as well as you are right now in your life. I'm
I'm
amazed that
doing
you keep up with those 3 little kiddos because you don't sleep, do you? And then they start to sob and they say, "How did you know? I don't know how I'm keeping up either." And we say, "'Cause you can't breathe.
Oh
Look,
my
look, it
Mhm.
looks like
gosh.
this is a massive infection in your sinus from this failed root canal. No wonder." And that's really where the beauty in what we do comes, is when we are able to put pieces together for patients with things they've been struggling with for sometimes decades, having no answer. I feel
Yeah.
so sad when I am the 7th dentist or the 7th doctor on the list. I think, "Oh, if only people knew to come to us first."
Yeah.
And it's really interesting. I went and trained in Switzerland, and when I trained there is a model where it's a dentist and a doctor side by side in a practice. And they explained to us, they said 60 to 80% of disease is going to be taken care of by the dental work we are going to do. And we can get that done within 6 months' time. Like, we're going to just knock it all out of there. In fact, most of it's done on the first or second visit. And then the doctors have to take over for the remainder, 20 to 40%. And it might take them years to clean up the rest. But we can do so much to get on top of disease and to
Yeah.
bring people back to their life that
Yeah.
they've always wanted.
Yeah.
And that's the beautiful thing. So we see lots of warning signs, but the key is finding a dentist that can turn those warning signs into answers for you.
You
So
know?
let's talk a little bit about, I know in breast implant illness, there's no true test that can be done to, to show a woman that she's experiencing breast implant illness. I wish there were a sampling opportunity. I know when it comes to dentistry, are there opportunities for you to sample, right, anything that's going on in their mouth to find out what illnesses might be presenting themselves?
Yeah, I mean, we can do a microscope slide, chair side, which will show some of the most pathogenic bacteria in your mouth, spirochetes, amoebas, trichomonas. Like, none of these bad bugs will exist in a healthy environment.
Right.
And they also won't exist around really healthy teeth. There has to be other issues going on for those type of bugs to manifest. We can do a full salivary panel, which will show the correlations between diabetes, Alzheimer's dementia. A lot of cancers will show up in the mouth first because certain types of bacteria from the mouth can cross the blood-brain barrier or cross other areas into the breast, into the colon, especially. And then we can also look for some other autoimmune factors. It'll test you. You can find out if there's Lyme disease starting in the mouth, Epstein-Barr, yeah, subclinical shingles. It's really interesting because until someone has a flare, we don't really know. But we can actually see that the bacteria are present all the time if they have anything harmful going on. So I do love that we can sample. And then again, I love that a lot of these issues will show up on the x-rays also, the 3D combing we were
Mm.
talking about. Because again, like one of my patients who had breast implant illness, her issues were with her joints, fatigue, and then she kept having full body hives that went on for about a year. And they told her just to take um,
Steroid shot, whatever. Yeah.
yep, for the rest of her life,
Yeah.
to take them around the clock, and sometimes it would be her whole body, sometimes it would be one arm, but it was so disruptive she couldn't even work.
Yeah.
And she took it upon herself to get some of her dental materials out, then she finally got her breast implants out and then never has had an issue even since the day after the surgery. And so, unfortunately, until you take those out, you don't really know if there's a correlation or not. And then also, you want to know, at least for me, I like sampling the teeth I take out to see what type of bugs and pathogens are around them. And I would love it if more surgeons were doing that too, so they could really see that there is truly a correlation between what can be encapsulated in there, and what's going on with symptoms outside of the breast themselves. Yeah,
Well, and I'll say this,
fascinating.
I've said this many, many times when it comes to, breast implant illness and having an implant in there. It's a petri dish, right? And our mouths are very much a petri dish, right?
Oh,
For
oh yeah,
any, right? And when
yeah.
Dr. Michelle brought that up about, the corrosion and whatnot, there is so much opportunity in our mouth for so many different things. It is a petri dish times 10. And
Yes.
people don't even know it, right? Like and again, I bring it back to my experience, my ear issues, constant, my eye issues. I know it's all related to what's going on in my mouth. I know it for a fact. And I know I'm already fast forwarding in my mind when this surgery happens, how much better I'm going to feel and how all these symptoms are going to go away immediately.
You know what's wild too that I've really gotten into the woo-woo side is the emotional component too.
Mhm.
There's so many emotions that are held in our jaws and our
Yeah.
mouth,
Yeah.
embedded trauma,
Yeah.
and also a lot of people, their symptoms manifest emotionally first.
Yeah.
It's either from the lack of sleep or the fact that they're feeling so on edge because their body's fighting something that they don't know what it is.
Yeah.
So you're in constant fight or flight, which becomes really fatiguing, and it will manifest as perimenopausal symptoms,
Yeah.
mood swings, depression, um, super agitation. There's a lot of emotional issues that'll manifest in the mouth first too, and I think that that's really interesting because it can be so disruptive for people in their relationships.
Yeah, no, it can be,
Um,
and again, and it goes back to just this the storage of it, right? The
yeah,
storage
yeah,
of all of the unprocessed trauma, and it can manifest in so many different ways in your mouth, right? I
yeah,
know for me,
absolutely.
it could be, your tight the jaws when you grind at night, right? I mean, that
Yeah.
that right there is a whole different ball game as far as, unresolved emotions, right?
Mhm.
Yeah.
Yeah, and so it's just a lot of people, especially women, feeling not like themselves.
Yeah. They're
So
living
I
outside of
think
their bodies.
yeah, yeah,
Yeah.
and I think being able to correlate that with an actual foreign body or dental material or some low grade infection, I think is really empowering for a lot of people. Just because they finally feel like they're able to clear out this issue that they felt going on. They just didn't know what it was.
And they're being heard for the first time when otherwise, and again, I'm pulling from my own experience, right? When you're gaslit by people you're supposed to trust in this profession, right? And you find someone like yourself and Dr. Michelle who are empathetic, who are caring, who are understanding, who truly want to peel back the layers and find out what's really happening with this person. Just based on your expertise in your profession, but let's peel back these layers and see what's really going on to give this person relief, whether they're a woman or a man, but women primarily because we have hormones, disruptors, and we have all these issues with pre, and post menopause. It's all related, right? And if you can have someone like yourself or Dr. Michelle really listen to you and go off of the testing, go off of what you're seeing visually and peel back the layers and get this person some relief. That to me is worth its weight in gold because not a lot of doctors do that. Not a lot of practitioners do that. They don't take the time because there's too much money in big pharma, right? There's too much money in just pushing what the narrative is
And we're
versus,
so
you know,
indoctrinated with that.
right,
It's first line
right.
of defense. If you have a
Yes,
toothache, doesn't matter even identifying what the cause is, the
right.
average dentist will call you on an antibiotic, not even
That's right.
knowing if that's anything that will benefit you.
Okay, Dr. Jorgen. So Jorgensen. So tell me, how do dental materials and oral care products act as chronic, low grade stressors over the body over time?
There's a whole variety of dental products. So we can, do we want to talk about mercury? Do we want to talk about root canals? Do we want to talk about the products that we put in our mouth? It's across the board, all of those kinds of things. So let's just start with, first of all, the products that we use, right?
Right.
And I know that that was part of your story, that you were using a lot of toxic products and found that your body wasn't able to be well when you were doing that.
Yeah.
So if you look at the back of your toothpaste or you look at the back of your mouthwash, what you're going to notice is that most of the ingredients you can't pronounce, right? You're looking through and you're thinking, I don't have a clue what this is. Not only that, but it is absolutely synthetic material that's used in the lab and largely put there to make it so that that toothpaste has a better mouthfeel, or it foams up better, or it's whiter. They're not actually there to do you benefit
Mm.
for a good reason for you.
Wow.
So most of the things in those products are simply there to make them not dry out in the tube or look a pretty pink color when you're drinking the bubblegum flavor mouthwash or whatever it might be. So all of those things that are additive are not only not intended to be there for a useful purpose, but they're often the exact opposite. They're often doing things that your body doesn't want, and it's trying to get rid of them, and it's causing a lot of inflammation in the system. So when I started actually creating product myself, it certainly wasn't something that I got into because I've always dreamed, it's not I was a little girl and I was dreaming about creating tooth care products. That's
Yeah.
not
Yeah.
that's not the story.
That wasn't your nighttime like journal entry.
No, not at
Right.
all.
Right.
No, but I started working with a lot of prominent people in the health and wellness world as patients. And I started working with one that does a lot of manufacturing of clean products.
Oh.
And finally, I just said, I can't find something that I really like have you ever been interested in creating one? And she said, yeah, the hardest part is the formulation, the making it. So if you can make it, I can market it. I said, all right, well, let's figure this out. So I literally in 2 weeks had made it in my kitchen. I'm a cook. I love to put things together. So I created this product in my kitchen, and I only put in the things that I knew would actually be beneficial. And
Wow.
because of that, I didn't make a toothpaste. I made a tooth powder because I
Okay.
couldn't figure out how to make a paste without putting in all the things I didn't want, like sodium lauryl sulfate, which is a foaming agent, but it also creates a lot of issues. I couldn't figure out how to do it without glycerin. Glycerin
Mm.
gets in the way of things getting into the tooth and remineralizing well. I couldn't figure out how to do it with things like titanium oxide, which is a colorant. It just basically makes it a bright white color. Has nothing to do with you, and in fact, it creates titanium overload and oftentimes metal sensitivity and reactivity in the body. I couldn't figure out how to do it. So I created a tooth powder, and million bottles sold later, we actually do have a toothpaste now. I figured out how to do it now using some other things, but that's what you need to realize is if you
Yeah.
wouldn't actually eat what's on the label, you
Yeah.
shouldn't put it in your mouth because you are swallowing a large amount. I mean, we've done research studies. It's like 7% of your toothpaste you're swallowing, but 7% of unpronounceable lab ingredients that aren't there to actually do something beneficial, maybe we shouldn't put.
Yeah. So that's
So,
interesting. So that leads me to, so given that there probably is a high probability of systemic inflammation because of the fact that, again, and I take this approach with everything I eat, right?
mhm,
If it's more than 3 ingredients, it's not happening, right?
yep.
Which your story is pain to purpose, which I feel like all of us have a pain to purpose story, which leads us to do what we do. So with the systemic inflammation that does occur with some of these over the counter products, for example, that aren't your products because you've obviously done your due diligence and you know what you're putting into your body. How much of these over the counter or commercial brands would you say are also hormone disruptors?
So the interesting hormone disruptor is largely the fluoride in them.
Oh my
Let's talk
goodness.
about this.
Oh
So
my, okay, wait, hold on a second, because the marketing campaign, Dr. Jorgensen, around fluoride treatment and
yep,
fluoride,
yep.
this is going to blow people away. Okay, please, let's go into this.
Yes, because and it's coming from inside the dental world. You know, any dentist that you talk to that's been traditionally trained, and we all have, there is no such thing as a as an alternative or a holistic dental school. You know, so we are
Right,
all trained the exact same way. We find our way to a different path from for other reasons, right?
right.
So we're all trained that fluoride is the save all, it's the end all be all for dentistry. So let's talk a little bit about the genesis of that. So first of all, fluoride actually does work. It does strengthen teeth. It absolutely
Yeah.
does. There's a lot of research to prove this. In the 1940s, they found some different societies that were getting more fluoride naturally. They had higher fluoride in their well water. And they said, "Oh, their teeth actually don't get cavities as easily." They had kind of brownish, whitish splotches on them. They didn't look real great, but
Oh,
they also didn't get cavities. So they said, "Okay, if we can control the level of fluoride, if we can do less than they're getting, then I think that we could literally eliminate cavities. So let's put it in toothpaste, let's put it in mouthwash, let's put it in the water, let's put it
everything.
everywhere, and we'll be able to eliminate cavities." So the first thing I always ask is, did it work? Has anyone had a cavity since 1940?
Yes.
Exactly. I'm like, this is
Not, that doesn't take a rocket scientist to figure
yes,
that one out, right?
there have
Multiple cavities.
yes, there have been cavities since 1940. So we know
Right.
it didn't achieve its ultimate goal, right? Of completely eradicating tooth decay. So we know it didn't do that. Does it strengthen teeth? Yes, it's great. But the problem is that anything we put in our body, and this is what you're talking about with improving your health and changing your diet, anything you put in your body, it affects every single cell, not
Oh,
just the one you want it to affect. So fluoride does strengthen a tooth, non-debatable, but it's also going to affect every other cell. So what are some of those other cells? Well, the first thing is it does swap out the calcium in the enamel. So the enamel is it's the mineral of the enamel is called hydroxyapatite. Well,
thank
fluoride,
you.
yep, hydroxyapatite, that's what
Yes.
teeth are actually made of.
That's a
That's
buzzword right now. That's such a buzzword right now.
smile. So when you
Yeah.
smile, you're looking at hydroxyapatite, okay?
Yeah.
It's a mineral complex. When fluoride is introduced, it pushes calcium out of that mineral complex and it replaces it and it becomes fluorapatite. Well, fluorapatite is stronger, but also slightly more brittle. The problem
Mm.
is that guess what else uses hydroxyapatite? Our
Mm.
bones. Our bones and our teeth are both made of hydroxyapatite. So stronger but more brittle bones is a problem, correct?
Oh, yeah,
Yep.
yeah.
We're seeing now issues with bone density and bone
Yes,
brittleness because the fluoride
yes.
doesn't just affect the teeth cells, it affects the bone cells too. So that's strike number 1 in my mind. Strike number 2 is the one you're asking about, which is hormone disruption.
Yeah.
So the thyroid hormone is activated by iodine.
Mm.
And this is very well known. It's activated by iodine. Well, fluoride and iodine are cousins. If you remember back to junior high chemistry class on the periodic table, they're sitting right next to each other. We've got fluoride, iodine, chlorine, bromine. They're all cousins. Again, fluoride is the bigger bully. So it will actually push iodine out of thyroid hormone and it will bind instead. So you get a
Ah,
test and it says your thyroid hormone is fine. You have plenty. You're I don't know what you're complaining about. Why are you tired? I don't know. But the problem is that
so
thyroid
true.
hormone has been activated by fluoride,
Fluoride.
not iodine, so it's not usable. And I just ask, how many people do we know that are thyroid deficient, that
Yeah,
have these hormone just I'm tired all the time, I don't have
yeah.
to go, and they get a blood test and they're told you're completely fine. It's
Oh,
because fluoride is deactivating basically the thyroid, and this is the crazy part. Fluoride was used as a treatment for hyperthyroidism in the 1970s. So if your thyroid was overactive, they intentionally gave you fluoride because they know it decreases thyroid function. So now what happens?
amazing.
I like to think of the body as basically being pulled by it's like a cart that being pulled by two horses, the thyroid and the adrenals. So they pull equally. They should pull equally. But if the thyroid hormone just got killed by fluoride, now the adrenal horse has to pull harder. And when that adrenal horse pulls harder, it runs out of steam. And this is where we see things like adrenal insufficiency and cortisol spikes. And here's the crazy part, all hormones are made from the same building blocks. So if you use up all your hormone building blocks making extra cortisol to make up for the fluoride killed thyroid over here, then you don't have enough building blocks to build estrogen and progesterone and testosterone. And so your entire hormone axis is thrown off because fluoride has interfered with the way that your energy processing system is now working. Your thyroid is no longer working because of fluoride. So that's strike 2. I have to say strike 3 here. Strike 3 was a study early 2025 that showed that higher levels of fluoride directly correlated with lower levels of IQ, particularly in male children. They could directly correlate this. So now I ask, okay, so it didn't eradicate tooth decay. We still are getting cavities. It leads to bone density issues and fractures. It leads to thyroid problems, which then leads to hormone issues, and it lowers IQ levels in our society at large. Is it worth it?
You have just hit 5 different points that I'm visualizing in my head about studies that are coming out, conversations that are being had about the connection between oral care, your oral microbiome, and your overall health. This is why I feel like when you go down this rabbit hole, and I'm going down it right now, I've been going down it for probably 15 years about, the issues in my ears and my eyes and my sinuses can't just be my ears, my sinuses, and my eyes. There's something going on in my mouth. Like, let's just break it down. When you have cavitation and infection, let's look at everything, right? So you just hit 5 different spots that I could spiral into right now. And again, when I was in Dr. Vane's office, and I will analogize it this way. When I found out that my breast implants were making me sick, the light bulb went off in my head about all the symptoms that I was having. When I left Dr. Vane's office about a month ago, the light bulb went off again because of all the issues that are lingering. I am free of all the stuff that I've removed from my body, done every protocol, do all the things, very woo woo times 10, but there was still something lingering. And I just had this funny suspicion that it was my mouth because I had some dental work done. I had this titanium rod. So for me, it's very gratifying to have those aha moments. And I can't imagine as practitioners how satisfying and how overwhelmed with joy you must become when you see your patients just go, oh my gosh, she's found out why I'm so sick all the time, or why my hormones are off, or why I'm, whatever it might be. The oral health, overall wellness, whole body component is so important because it is there, right? Our mouth is a precursor to everything else going on in our body. So this has been a great conversation, and I know that everybody watching and listening will see the connection between oral health and whole body wellness. Rapid fire real quick. Dr. Vane, one dental ingredient or material you absolutely avoid. I think I know the answer.
Oh, well, I can name 3 that come to the top of my head first.
Just one.
Mercury, fluoride, and triclosan.
Perfect. Dr. Michelle, biggest red flag in a dentist. We probably know this one already.
Somebody who's not willing to actually look at the research and change what they do based on what they see.
Got it.
Yeah.
Dr. Vane, most underrated habit for long-term and systemic health.
Underrated habit for long-term and systemic
And
health.
systemic health. Most underrated habit for
What
long-term and
what came to mind first was gut detox. Doing
yeah,
a lot of gut
yeah,
reestablishing your microbiome, oral and your
yeah.
gut microbiome is
Big connection there. And Dr. Michelle, one change people should make starting today.
Don't use toothpaste or mouthwash that you cannot pronounce the ingredients in, ever.
Let alone if there are 25 ingredients. So before we wrap up, Dr. Michelle, I know you've got some events that are coming up. I'd like for you to share what those are so that my listeners can either, if it's something they can participate in, but you have something coming up in California, why don't you share what that is and when?
Yeah, so in June 26th through 28th at the absolutely gorgeous 1440 Multiversity campus that's just north of San Jose, California. It's up in the Redwoods. We have a women's wellness weekend that's being headlined by myself, Dr. Darla Booth, who's incredible, talking about inflammation and inflammaging is what she calls it, and hormone health
I
and
love that.
brain health. I love this.
Yeah,
And Dr. Mindy Pels, who has been all over the
yeah,
news lately with her Fast Like a Girl, Age Like a Girl information.
yeah.
So we are going to be joined by an esthetician, by a pelvic floor specialist.
Oh.
It's a weekend all for women, how to become our best selves. And the title of it is How to Thrive in Our Season. So basically, wherever we're at right now, how can we feel our best? So we would love for you to join us because this is an all-inclusive event. You get your lodging, your food, which is spectacular food, the gorgeous surroundings, all of the education, as well as yoga and all kinds of fun stuff. I was just there this last weekend, so I can tell you all about it. It's so incredible. We would love for anybody to join us.
So where does someone get this information and how does one get in touch with you, Dr. Michelle?
Yep. So 1440.org is where you're going to go for information, or also contact me. Living Well with Dr. Michelle is where you're going to find me. So Living Well with Dr. Michelle.
I love that. Dr. Nicole, anything exciting going on that you want to share with us before we part?
No, I'm just excited to take more trainings. I love working and training under Dr. Michelle. She has a great teaching facility for dentists that are more interested in learning the wellness and biologic path. And for me, I would just invite anyone into the office to be able to help them correlate maybe what their symptoms are
Right.
that they're suffering from with a full body scan and doing the full CT scan. Yeah.
Yeah. Well, I can tell you guys firsthand, for those of you who are listening or watching before we wrap it up, if you are on this journey of really figuring out what's going on with you, whether you're in your 20s, 30s, 40s, 50s, in my case, I'll be 60, there is a huge connection between your oral health and your overall body wellness. And if you are interested in learning more about this, reach out to me, reach out to either doctor. They do televisits, I'm sure. And if not, they can probably reach out to you in terms of how they can work with you. But there is a huge connection. And especially if you're women with hormone issues, I'm telling you right now firsthand, go have your mouth looked at by a biologic dentist. First and foremost, because that will be the precursor to what else is going on in your body. I am living it right now, and I can't wait to have surgery done by you, Dr. Vane. Get rid of these cavitations, get rid of all the nonsense in my mouth, because I am telling you, I am my own science project. I am my own advocate, and I am grateful for both of you for being pioneers in this field, for being, forward leadership for both of you. You're women that are just a force to be reckoned with, and I am so honored to have you both on here today. So thank you for taking the time. Thank you for your nuggets of wisdom. Thank you for all of the educational components of this podcast interview today. So I appreciate both of you. And if you have any questions, direct message me. I will get you in touch with either of these doctors. As always, stay tuned for the next episode of Under Contract. Make those contract commitments to yourself and honor them. Peace out.